Hello everyone, myself Tulsi Patel. I am working as nursing tutor at Knowledge Institute of Nursing at Ireland. So today we will learn about physical examination of the nose. So for physical examination, we have to do full nose examination, assess the function, airway resistance, and occasionally sense of smell. It includes looking into the mouth and pharynx. The common symptom of nasal disease includes if you are going to assess, you must have to know about what are the illnesses occurring in the nose or the nasal system. Okay, so if you will know what are the problems, then only you will find it out that what are the problems patient is suffering with. So the first one is airway obstruction. That like a person will have any foreign objects in the nose or with like any allergies, pollen, grains, and anything. So the patient will suffer with airway obstruction, or patient is suffering with asthma or bronchospasm or anything. Asthma is called as like bronchospasm of the bronchus, right? So due to that, the patient will suffer with airway obstruction, and patient won't be able to breathe, and it is life-threatening condition then. Then the next one is rhinorrhea, means runny nose, which you are all suffering with. In common term, we call it cold. Then next is sneezing, then loss of smell, which is called in anosmia. Like in medical terminology, loss of smell means anosmia. You have to remember this term. Then facial pain caused by sinusitis, like we all know there are sinuses present in our faces, so we will study about it later that how we are going to examine it. The next one is snoring, which is associated with nasal obstruction. Snoring is normal, but sometimes it is like linked with if any bone is obstructing the nasal pathway, then the person will snore more, so that is called nasal obstruction. So what you will collect in your subjective data. So ask about discharge or any nosebleed. Many of you have suffered with epistaxis. You must have you must remember that what are the symptoms and all the things. So first of all, you have to take history about epistaxis, then facial or sinus pain, then history of frequent colds, alter sense of smell, allergies, then medications being taken if patient is on regular medications or whatever, then history of nose trauma or surgery. Okay, so these are the history or information you must have to take from your patient while you are examining the nose. You must have to know about these details. Then the next we will move forward for the technique like inspection. So first look at the external nose. Ask the patient to remove any glasses. Look at the nose from the front and side for any signs. Nasal bridge deformity, or we can say saddle nose or hump deformity. So if you observe that, you have to report it. Then swelling, then ulcers, sinuses, growths in on skin, then scars, then broadening of nose, and inflammation and cellulitis. So the external nails are palpated for displacement of any bone and cartilage and for tenderness and masses. So here you can see this one is the sphenoid sinuses, as I have already taught about the sinus. So this one is sphenoid sinus. Here the frontal sinuses are located. Then here just in the starting of the nose there is ethmoid sinuses. Then comes nasal cavity, and then at the end maxillary sinus, and it is all connected with pharynx. So you have to remember this paranasal sinuses. These all are sinus names. Okay. The internal layers are infected by hyperextending the neck of the client. The ulnar aspect of the examiner's hand over the forehead of the client and using the thumb to push the tip of the nose upward while shining a light into the nails for examining the nose. Okay, you have to remember this technique. Inspect for the following: position of the septum. Sometimes many are suffering with nasal septum deviation. So that is the deformity, and to assess that whether the patient is suffering from that or not, you have to check the septum for perforation can also be checked by directing the lighted pen light on the side of the nose, and illumination at the other side suggests perforation. Okay, so that's how you can assess the nasal septum deviation or perforation. Okay, then the nasal mucosa turbinate for swelling, exudates, and changing color. You have to note it down if patient is having any exudates or patient is having any swelling in the nasal mucosa. Okay, then these are the paranasal sinuses that we have seen before too. Like this is the front view of that. So here is the frontal sinuses, then comes the ethmoid and sphenoidal, and at the last there comes the maxillary sinuses. Okay, so that's how you will identify the places like the location of the sinus, and you will find out about the abnormalities. So by palpating the both cheeks simultaneously, one can determine tenderness of the maxillary sinusitis, and placing the thumb just below the eyebrow, we can determine tenderness of the frontal sinuses. So for palpation, you must remember the places of sinuses, like which sinus cavity is present at where which place. Okay, that's how you can remember. You can see this picture how you can palpate the maxillary and frontal sinuses. And if patient is feeling any tenderness, you have to report it to the physician. So examination of paranasal sinuses is indirectly. Information about their condition is gained by inspection and palpation of the overlying tissues. Only frontal and maxillary sinuses are accessible for examination. So whether you are going for examination of paranasal sinuses, you have to remember that the frontal and maxillary sinus, these two only are accessible for examination. Okay. Then what is the norm of finding? So nose is in the midline, no discharge noted, no flaring melanacea. Then both nails are patterned and no bone and cartilage deviation noted in the palpation. Then no tenderness noted on the palpation. Nasal septum in the midline and not perforated, as I have explained. The nasal mucosa is pinkish to red in color. Increased redness or turbinance are typical of allergy. If patient is having any, dust or pollen grains or tender allergy, so the patient will have even increased redness and turbinance in that. Then no tenderness noted on palpation of the paranasal sinuses. If patient is having this, patient is suffering with sinusitis. The condition called sinusitis. And you have to remember that, and you have to notify it to the doctor. Okay. But you must document everything, whatever you are finding out in the patient, whether it is normal or not normal, you have to document it. Then last one is olfactory. The first cranial nerve we are going to assess. So the first cranial nerve is responsible for sense of smell. So to test the adequacy of function of the olfactory nerve, the client is asked to close his eyes and occlude. The examiner places aromatic or easily distinguished nose. We have to take the object which is easily, which is aromatic, like coffee or lemon, anything. So ask the client to identify the order. Each side is tested separately, ideally with two different substances. Okay, then, and if the patient is able to identify that, then you have to document that person's olfactory nerve is properly working. Okay, there is no any complaints about that. So that's what about the assessment of the nose, and thank you for listening.